Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning, good morning. What a great way to start the program.
Exactly.
Well, we have such attractive people in here at this show. We still have to get those cameras in here. This is, I want to tell everybody, listen, Dr. Mencia, I have to spell his name because apparently somebody went to the wrong doctor because they didn't really know the doctor's name. M-E-N-C-I-A. Hey, that's a good song. M-E-N-C-I-A. Mencia, right?
Men from the CIA.
Oh, men from the CIA, right. Oh, that's very good.
Yeah.
I like that. So, Dr. Mencia, you surprised me this morning with these good-looking people here. What are we doing, a Broadway show?
Yes. We brought Stephanie and Dennis Tan, and they work with Lab Solutions. And I know Dennis for a long time. We know each other for years, and he worked with other company. But yesterday we had a lunch meeting with the staff, and Dennis was telling me about this company that he works with called Lab Solutions. Mm-hmm. So he was telling me about, the genetic testing and the cutting-edge thing that are coming with this interesting lab that is based in Atlanta, Georgia. Mm-hmm. And I said, Dennis, I believe so much in genetic testing and in preventive medicine that I'm going to have you and Stephanie come to the radio show tomorrow. So we have them here today. Welcome, guys.
Thank you very much. I really appreciate the opportunity to speak about Lab Solutions. And,
but I want to just throw this out because this is very cutting edge medicine, isn't it?
This is very cutting edge. This is truly preventive medicine to the max.
Well, let's talk about how it affects your patients. So then people will put it down on a first grade level here.
There are two types of patients that come straight to mind. If you had been adopted and you have no idea what your past family history is all about. So that means you cannot foresee your future. You don't know if you're going to have breast cancer, uterine cancer, ovarian cancer, pancreatic cancer. All of these cancers are out there, and we have the genes to develop diabetes, to develop cancer, but we don't know who's going to flip and turn into a cancerous cell. So that's the first person that come to mind. And I have so many of my patients that when you get the family history, say, I really don't know I was adopted. And then you have the other side, the people that they know that their mother has uterine cancer and their aunt had ovarian cancer, and they are in their late 40s, and they come and they say, should I just go ahead and take my uterus and my ovary out? And if you do the genetic testing and it shows that the ovaries are fine, that you are at very low risk of ovarian cancer, but the uterine is a high risk of uterine cancer, I would rather have you just go and take the uterus out because the ovary in your late 40s is still providing you with hormones that the woman needs so they don't get the hot flashes and all the stuff when we go through menopause. So, we hear about Angelina Jolie, she went and had the bilateral mastectomy. So if you have a person, preventive medicine is what she did. She know the history was there, and she opted to remove the breast and get some implant and do whatever she need to do before anything gets found in there. Now, let's go to the case where you don't do preventive medicine. You do reactive medicine, what I call reactive medicine. Reactive medicine means that you develop something, then you go and get it treated really quick before you die. When you do reactive medicine and you have a little lump, you develop a small lump in the breast, any surgeon in this country will not remove that lump without also removing some lymph node from the axilla. Once you jump into the axilla, it's a completely different ballgame. Now those lymph nodes can come back negative, but they still have to go and remove them. That's the only way they're going to know. The surgery is already there. Now you can develop lymphedema of that arm. They cannot draw blood from that side anymore. And then you go through all the rigmarole of all these things that you have been doing because you underwent that surgery. Yeah, we save your life.
Right.
But at the same time, we did create some damage that you're going to have to live with.
Right.
Okay, so now fast forward. So you're saying now that if we use this, I'm going to get that exact name, it's called
PREDICT, which is a comprehensive hereditary cancer risk assessment.
Oh, okay, PREDICT. So Lab Solution does something that sounds like it's pretty new. So tell me then, why don't we just have you discuss, what do you have to do to me? Do you have to cut my hair? Tell me what you have to do to give me that test.
We probably could get the DNA from your hair, but we have two ways to collect samples, and one's cotton swab inside the buccal area of your mouth, which the physician would take from the patient, and we just send it into the lab. And the other way is through blood, through just drawing blood and getting DNA samples from the blood.
Okay, so now what's it going to tell me?
Well, what it will tell you is if there are mutations in your DNA that signal a higher chance or probability that you may develop breast cancer, colon cancer, uterine cancer, endometrial cancer, something called Lynch syndrome, Cowden syndrome, and these are diseases that, if you, like he said, if you're adopted and you don't know your family history, but you see but the lab sees these mutations in these specific genes in your DNA, it gives you a better idea of whether or not you may be susceptible to these kinds of cancers.
And how to move forward.
And how to move forward, correct. How to live a healthier lifestyle, or, with cancer, the sooner you find out, the better, correct?
So in other words, people who smoke, they would maybe even be more prone not to.
Quit smoking, right?
Because
they say,
you know this.
Yeah, if they say, okay, now that I know I have the risk of colon cancer, so if I stop smoking, if I eat more fiber in my diet, and you start going through the list of things that you can do,
correct,
and go to the screening. Some people don't want to do colonoscopy. They say, I don't need it. I don't want to know. If you know that everything is there and you go through your colonoscopy and everything is fine, the likelihood of you developing colon cancer is close to zero.
Yeah.
Correct.
So that's so. What you're saying then, if you get the test, and then you say, oh, well, you could be prone to colon cancer. Let's go get a colonoscopy. Now it is more,
and let's modify our lifestyle.
Right.
Because remember, when you get a colonoscopy, if we find a small polyp in the colon, if that polyp remain there, it takes about 5 years for the polyp to convert into cancer. So if it's a benign polyp and they remove it, it will never convert into anything. It will remain benign. It was taken away. If it started developing to cancerous cells in the polyp, usually starts at the tip. So when we remove it from the stern. So when we remove that polyp, we prevented that cancer that was in the process of developing from reaching the rest of the colon.
Well, I'm pretty excited about this whole thing. I'm thinking about it, and then we have this other beautiful person here from your company, Estefania. I was going to say Estefania. I'm going to forget the S. Estefania. I could handle that. Sanchez. So this is something that you must be very excited about also, because you're... As
a woman, right?
Because you can appreciate how important this is. And I don't know if there's anything like this in your family, but you would...
No, I never had any, in my family, any cancer, but it's, of course, it's actually because I don't think about that because I'm 26. But then when I saw all this company that we just start recently, I start to open my mind to thinking about also not about me, but my family and cases that I have friends maybe with the mothers that they had a history of breast cancer that I never thought about. It could be like this kind of test in the like in the pharmaceutics that they can like make easy like doctors' job too.
Well, absolutely.
Sure.
Well, it's not. I'm gonna do
I
just
know
that.
one thing, Stefania.
Stephanie, I'm gonna forget the E part because I've got a daughter-in-law, Stefania. Stefania. You know, when you think about it, though, women like you, of course, you're young, and you will maybe have children if you want to. This is very important for you to know what's going on, and I guess we're just talking about cancer, but is it going to detect other things also?
Yes, there is like some.
Yeah, I could jump in on this, but well, you know, let's first and foremost let's get something clear. Even if you have these mutations and they're detected, it's not 100% chance that you're gonna develop breast cancer. So I want to clear that. But what it will do is give you an idea of that you have a better chance or more. I shouldn't use the word better. You have a higher chance of developing breast cancer or colon cancer if you see these mutations on these specific genes. So, but another part of the DNA testing we do is called pharmacogenetics.
Which I love.
Yeah, Lab Solutions is a full service lab that we also have incorporated pharmacogenetics, which tests your DNA to see what medications you metabolize faster, don't metabolize at all, and basically it gives the doctor, the physician, a roadmap on what medications you as an individual should be taking, or not just should be taking, but are better off taking.
Yeah,
okay,
yeah.
so that's,
they call me Dr. Practicality.
I was just going to say, no, because you absolutely have been so strong on medications and watching that and not giving people lots. So this must be something thrilling to you.
So let's go back. Before this test came out, a person go to the emergency room because they are having chest pain and they are developing a heart attack. The protocol is we're going to give you aspirin, then we're going to treat you, and we're going to prevent the death. And you go through the whole protocol. Then you go home with whatever medication plus aspirin. So something to lower your cholesterol, something to control your blood pressure, something to dilate the blood vessel in your heart, and a baby aspirin or a full-strength aspirin. If the person came to the hospital with the same condition and the person was already taking aspirin, what they're going to do, they're going to add Plavix to that. So now you take aspirin plus Plavix plus the cholesterol medication. Now, let's think about, and this is before when we were blinded to what the patient could really do with whatever medication we were giving. When it came to blood pressure medication, we have dozens of medication to pick from. When it came to cholesterol medication, we have dozens of cholesterol pills we can choose from. And different type, different family of drug that we can choose to give the patient. We had no idea that you were going to be what we call an aspirin failure until you came back to the emergency room with a second heart attack while you were taking the aspirin. We say, you are an aspirin failure.
I've never heard the aspirin failure.
That means that the person developed a stroke or a heart attack while being on the drug. So that means the drug didn't do what we were expecting the drug to do. If the patient was really taking the drug, if the person say, I keep forgetting to take it, then, that's different. But if the person was actually taking the drug and you believe your patient that they were doing it and they develop another stroke or another heart attack, I mean, they failed the treatment. So you call them aspirin failure. There are patients that you give them cholesterol medication. And they say, doctor, I swear to you, I eat properly, I follow a good diet, I exercise, I'm taking my pill. Why my cholesterol is not going down? And we look at them. Because they were poor metabolizers, or they didn't even recognize the drug. So imagine if you have this test nowadays, you have this test done on you, and the test tells you that you will never recognize aspirin as a medication that will thin out your blood. But yes, you will recognize Plavix. So the moment that person comes with that profile to the emergency room, we are going to bypass aspirin. We're going to go straight to Plavix because we know that's what's going to work to prevent the next heart attack. We are not going to give you Lipitor if we know that you cannot recognize Lipitor. Your genes, your liver doesn't recognize Lipitor. And then you have, so those are the people that do recognize, the one that don't recognize. Then you have what we call fast metabolizer and slow metabolizer. So the fast metabolizer is, well, let's talk about normal. Normal, if I give you a pill for the cholesterol and that pill works in a normal person over 24 hours. That means you can take one tonight, tomorrow night you can take the second one. If you are a fast metabolizer, within 2 or 3 hours, you metabolize the pills. It's out of your system. You got rid of it already. If you are a slow metabolizer that you keep working on that pill, it might take 2 days. And the slow metabolizer are the one that come and say, oh, I'm getting these cramps on my leg. I'm getting this muscle pain. I don't want to take this drug. And before we were blind, we had to say, okay, if you're having side effect, we're going to have to take you off. Now we can say, you know what? Don't take it every day. Take it every other day, every third day, 3 times a week. And they can still tolerate the medication because they metabolize very slow. They don't need to go that fast. Now, the pharmaceutical company, they make money selling pills, if we are realistic. So if I give you a pill and if you take it every day, I'm going to give you 30 tablets for the month or 90 tablets for 3 months. Mm-hmm. But if you are a slow metabolizer, 90 tablets might last you a whole year.
And the way you can tell this would be through this test?
Through the test, because you can break it down into fast metabolizer, slow metabolizer,
really?
Which drug you are recognizing. Drug like antidepressant. How many antidepressants we have out there? A lot of antidepressants. And sometimes, I was a psychologist before I became a medical doctor. So a lot of time I treat my own patient with depression and with bipolar, with schizophrenia. I start the treatment with them. I'm very comfortable doing that. Before, it was basically blindly. You say, well, let's try this Zoloft or let's try this Prozac or maybe we can try a little Elavil, and the patient will come back and say, oh my God, whatever you gave me, I was so hyper. I was like, ready to fly the coop. Or the other one, like, I couldn't wake up the next day. You put me into a coma. Right. And it's such a low dose that we are giving the patient. Now we can look at this and look at it. It's fabulous. I mean,
this is really beyond
this is really
belief.
Cutting edge.
But wait, it is. Well, before we continue, I got to tell everybody how to get in touch with you.
Mencia.
Remember, right, Mencia. That's right. Dr. Andy Mencia, and our September issue is about to come out for Boomer Dimes, and you can go to his office and pick them up also. To call for an appointment, and he is there on Saturdays, 954-489-1345, 954-489-1345, and that's in Commercial Boulevard. If you want to go up to Boynton Beach, you have to call that number, which is 561-270-6494. And the very good part about this is they do have home visit services available for homebound patients. If you want to know a lot more about them, just go to their website, which is AGI, standing for Adult Geriatric Institute, AGIFL.com. Okay, I do have a question, and this is, I would not ask this normally, but I know you so well, Dr. Mencia. You know so much about everything. How does that work inside? I mean, no, wait. I have a different way to put it. How does this gene testing know about all that stuff? This is a scientific question.
Yes, well,
See, I knew you'd know.
Yeah. Well, I used to teach science in pre-med. So, if you recall, when we were in high school and junior high school, they used to take a little saliva sample so that we can look what the human cell look like. So I remember being a little kid in school in Hawaii. We would take a little saliva sample and we put it under the microscope and stain it. And we say, okay, this is the nucleus, this is the cytochrome, this is this is that. So the saliva had the cells that we can analyze very easily without having to take blood. We can do a blood test also to look at the DNA format. And a lot of times, before this test came out, so well organized, we used to have a test we used to do on the blood for colon cancer marker, and we still do the prostate marker, which is the PSA. We do it in the blood. But as we move on and these tests get more and more advanced, a lot of these tests can be done just with a saliva swab. I mean, the person doesn't have to be stuck with a needle. So that's how this came to be. Now, we did a show, you and I, on the liver. The function on the liver and how the liver is supposed to metabolize everything that we eat and everything that we consume. And when we did the show, we were talking about people that take supplements. You know, all of those supplements that we take have to go through the liver. Now, in the liver, we have enzymes that I like to call windows. So we have triangular windows, rectangular windows, square windows, round windows. And if the medication that you take to lower your cholesterol is rounded, it's going to go through the rounded window. If it's rectangular, it's going to go to the rectangular window. So we call this the enzyme, cytochrome P450 enzymes.
Correct.
And those enzymes take the responsibility not only of metabolizing drugs, but also metabolizing different substances that our body consumes. It have to go through the liver and get metabolized there. And when you have a lot of those round windows, you might be a fast metabolizer. When you only have 2 and you're sending 20 round pills, the 2 have to slow down. It's a slow metabolizer. If you have no round window, you won't recognize the drug. So the liver has all these enzymes, these different type of enzymes that take the responsibility of processing the drug that we take, the different type of drug that we take. And supplement. And that's why I tell my patient, when you take supplements, some of my patients say, I take 20 supplements, I just put it in my hand and throw it in my... I say, no, they have to go through this window. You have to take a few in the morning, a few at lunchtime, a few in the evening, so that they can all be processed. Otherwise, you're wasting your money away. They're going to go straight down the gut.
And I know that we have less than 5 minutes, but so I was thinking... No, but wait. But I remember when I went in, of course, I'm your patient, and you took my blood test, and you said, you need to start taking vitamin D, and you told me something else. And so that's what you're talking about, that through the blood, you could see things.
Yes.
That's right, you could see things. So now, with this wonderful test, before you want to give me medication, you want to see how I'm going to process
how
this.
you're going to process
So that's really what we're talking about, isn't it? See, it takes a little while.
It's like closing the loop now, where we get more information. We are able to provide
much
more information.
This is such cutting edge. We need to talk to you about our Cure Symposium, because that's the kind of stuff we do.
Yeah.
They ought to sponsor you to do this. I mean, this is brilliant.
Yes.
This is brilliant.
I'm in.
No, this is brilliant stuff. And so you will then provide this test. And do a lot of doctors do this? Or this is
no, it's very cutting edge.
It's relatively new.
But relatively new. And unfortunately, there are doctors out there that still want to practice old-fashioned medicine.
Right.
And it's bad for the patient. You know, it's like if you have new drugs that have come out that are super clean, that will lower your blood pressure. Why am I going to give you something that is going to go into your brain and give you a side effect? Or prevent you from getting an erection.
This is absolutely...
erection. Talk about sex.
What did you say? There are drugs that
why are we going to give you a medication, right? But have all these ugly side effects.
I mean, can you actually
that don't let you look up into life.
I was thinking about Viagra then when you're saying that. Would you be able to tell? Would you be able to tell if it's going to work or not with this?
We'll be able to tell.
Okay, that's at the end of the show. Wait, I have to thank both of our guests, Dennis and Stefania, for coming. It was really wonderful.
Thank you so much.
I do want to give Dr. Mencia's phone, MENCIA, Dr. Andy Mencia. Phone number again is 954-489.